We're going to talk about three types of falls. Three types of falls. And these aren't, oh shoot, oh crap, and something else, right? These are categories in which we use in the clinical setting. And they are classified as physiological. You have physiological, you have anticipated, number one. You have another physiological fall, which is unanticipated. And then you have an accidental. And it's important that we classify these because they can identify other health issues, things like dementia. It could be polypharmacy where you're taking multiple medications and maybe two of these medications don't jive. It could be something like drop foot, or there could be something that's going on with the body that we need to address, we can fix, and we can correct. All right, really quickly, let's talk about number one, anticipated falls. It's a physiological fall, what we call an anticipated fall. These are falls that occur in patients who have risk factors for falls that can be identified in advance, such as altered mental status, dementia, Alzheimer's, abnormal gait, shuffling, frequent toileting needs, right? And guys, we've covered this before. Some of the highest times, the time frame in which falls occur the most are between 3 and 6 in the morning and then 9 and midnight, okay? And that's because we're all going to the restroom. As I've gotten older, I have learned that, right? So toileting needs, we'll talk about how we can fall-proof your home, especially at night. And then high-risk medications. Polypharmacy just means you're taking multiple medications. So someone who is categorized as an anticipated fall means probably they've fallen before in the last 6 months, and you can physically see risk factors. Does that make sense? Frailty, all right? A lot of times people who have osteoporosis, women, ladies, the postmenopausal women, you're at a greater risk of osteoporosis, osteopenia. And what happens if you don't do any type of load-bearing exercise, you'll step down off a curb and that impact will break your hip because your bones are so brittle and then you fall. Excuse me. So we want to make sure we're staying fitness, but the anticipated falls, we can see that. Excuse me. Now, what about the unanticipated falls? All right. These occur in a patient who is otherwise at low risk because of an event whose timing could not be anticipated. What does that mean? Maybe playing tennis and you're shuffling and you catch your foot and you fall, right? That's an unanticipated fall. Or you're talking and walking, whether you're talking to your friend or talking to yourself, right? A lot of us do that. I know you do. Don't try to say you don't talk to yourself. I know you do, right? I do too. It's okay. Or you talk to your dog and you go to step up on a curb and you hit your foot and you can't react fast enough, right? That's an unanticipated fall. Or what if you have a seizure or a medical event? Stroke, maybe you faint, and I've actually had this in class. Someone did not eat before a 10 o'clock class and they actually fainted, all right? So you want to make sure you're getting something in your belly. But these are unanticipated falls. That is a category where we put someone that is in otherwise good physical health, but because of a mishap, they have fallen, all right? Last one, and then we'll get started, is our accidental. And these are patients who are otherwise low risk, but due to an environmental hazard, they have fallen. Improving environmental safety will help reduce the risk of falls in these patients, but is helpful for all patients. What are environmental hazards? Right? We had just mentioned it when we were talking about fall-proofing your home. Picking clothes up out of busy walkways. Lighting your pathways at night when you're going to the restroom, right? Moving rugs and other things on the ground that look great. They look great, but they increase your risk for a fall, all right? What about something recently, hurricanes, right? We've talked about how natural disasters disproportionately impact our seniors in our senior community. You've got to be careful with hurricane season coming up. Guys, trees and things falling in places they normally will not be in the event. I don't know if I can do another hurricane, but if we do, be careful, all right? Be careful. Hopefully you have a way out of here. So with that, any questions? Let's rock and roll. It's time to get busy.